All right, so now that we've performed our lower core functional examination focusing on rotation control, we can start to do a few of our corrective strategies. Now, if they perform well with the VPAC strategies, whether it's the abdominal drawing in or the abdominal brace, and their movement cleans up, that's a corrective strategy right there, and so we can move on to a progression. When we don't see their movement improve sufficiently with a VPAC strategy, then we can choose to use a reactive neuromuscular facilitation technique in which we use a band to pull them into the dysfunction. And so here, go ahead, keep your abdominals relaxed, keep your heels together, lift your knee to the sky. If we see that disassociation between her thorax and her pelvis, that does not clean up with her VPAC, so go and give me a brace, lift up, and we still see that, then what we can do is try to feed that dysfunction. And so I'm going to take a band, and you'll tuck that right under your pelvis. And here, I'm just going to take this band, and I'm going to pull her into her dysfunction. You see? And my instructions to her are going to really tend to focus on external targets. So I don't want her to use internal targets because people with back pain, back dysfunction, or movement control issues tend to have diminished proprioception, and so those tend to be a little more challenging. So rather, I want to instruct her to perform the VPAC strategy that you're training. So in this case, let's do a little bit of a brace, right? And I want you to keep your pelvis parallel to that wall. So external target for the intrinsic motor learning. And so here I'm going to create the tension in the band to create the facilitation. So we've already jump-started her anti-rotators in the torso, and now ask her to lift her knee to the sky. And down, you can keep your heels together. And again, give me the VPAC and lift your knee up. And so we're going to see if she's able to keep that nice alignment between her pelvis and her thorax with this facilitation. As she gains proficiency with it, go and just keep repeating the motion. We can start to decrease the tension in the band to diminish the amount of facilitation that we're doing until there's no tension in the band. So essentially we're weaning her off of the facilitation and she's performing it, go ahead, independently. And so in which case, we're going to ask her to do a few reps to get an increased volume of practice of good quality motion, and then we can progress that through different strategies, load, speed, what have you, depending on your goal.